Each patient enters an operating room with a unique set of medical concerns, emotions, fears, and needs. The responsibility of caring for these patients rests on the professionals who provide care. Certified registered nurse anesthetists ensure freedom from pain for these individuals. A continuity of care that begins long before surgery and continues through recovery. And no matter what changes in our modern healthcare system, that responsibility remains the same.
CRNAs do the bulk of the anesthesia that's office-based or outpatient surgery across the country, and they have a more than very well-proven track record for excellent quality of care.
Nurse anesthesia is a specialty which requires rigorous education, certification, and critical care experience. Admission requirements to a nurse anesthesia program include a Bachelor of Science degree in nursing or other appropriate baccalaureate degree, licensure as a registered nurse, and a minimum of 1 year acute care experience. Didactic and clinical residencies in the anesthesia specialty range from 2 to 2.5 years. In addition, all anesthesia programs must offer a master's degree. Graduates from accredited nurse anesthesia educational programs must pass a national examination for certification as a nurse anesthetist. Recertification, which includes a practice and continuing education requirement, must be met every 2 years.
The Council on Accreditation of the American Association of Nurse Anesthetists makes recommendations relative to the minimum number of cases that are required for a person to take the certification exam at the end of their training period. This minimum number of cases is 450. Most programs, this one included, tend to exceed that number, usually doubling the number of cases that's required. Our students here average anywhere over 800 to 850 cases in their 2-year period. While there is not a minimum requirement as far as total hours of anesthesia time by the council, most students end up with over 1,800 hours of total anesthesia time.
Nurse anesthetists work in a large number of medical facilities, including hospitals, outpatient clinics, dental, pediatric, and ophthalmologic offices. They provide services at plastic surgery, ambulatory care, HMO, military, and VA centers as well. In many communities, nurse anesthetists are self-employed.
You're responsible to the patient. It's your job to make sure that patient is safe during the surgery. Of course, you collaborate with other people as a team many times, but also as the sole anesthesia provider, you're responsible to keep that patient safe. You have to know what you're doing. You have to know the technology. You have to know what's going on in the surgeon's mind and what's going on in the operative field, and you have to know the patient's medical status and everything about them. That's your job, and you have to be good at it. Nurse anesthetists are trained to be very good at it.
And providing emotional comfort before a procedure is as important as providing physical comfort during a procedure. Nurse anesthetists take time to learn about their patients and educate patients on things they should know before a hospital visit. Communication is important during this phase. Patients can feel comfortable asking questions of their nurse anesthetist and getting informed answers. There are a number of things patients can do to help ensure their own quality of care. First, clearly answer questions from your nurse anesthetist and other healthcare professionals. Follow their instructions exactly. Alert them to any health problems you may have. Provide a list of health conditions and any drugs you are currently taking. If you're pregnant, plan for anesthesia even if you intend to have a natural childbirth. Be aware that recreational drugs, prescription drugs, and alcohol use can affect anesthesia. After your anesthetic, do not operate a car or heavy machinery for at least 24 hours. Do not take any medications other than those prescribed by your doctor. And make sure you have a responsible adult to provide transportation and stay with you. Today's technology makes anesthesia safer and more effective than ever before. But it will never replace the care and support provided by certified registered nurse anesthetists. Your nurse anesthetist will be with you before your procedure begins and during the entire surgical procedure. They make critical decisions about your anesthetic care and will transport you to a recovery area at the end of the procedure.
We are watching every aspect of their hemodynamics, of their surgical procedure. We carry them from the beginning to the very end of it. And we also have the capability and the competence to provide post-operative care for our patients in the recovery room.
Certified registered nurse anesthetists are highly qualified, highly trained, expert anesthesia providers who provide the most cost-effective anesthesia care available. We are the best kept secret in healthcare today, and we're looking forward to providing another 100 years of cost-effective, safe anesthesia care in this country.